Every 40 seconds, someone has a stroke in the U.S., and at least 80% of them are preventable, according to the Centers for Disease Control and Prevention.
WIFR reporter Bria Walters talks to state-line doctors about the signs of a stroke and risk factors you can control.
Time is brain.
The month of May is National Stroke Awareness Month. Nearly 800,000 people in the United States suffer a stroke each year, according to the Centers for Disease Control and Prevention. Knowing the signs of a stroke saves lives.
Increasing awareness is really helpful in communities because it allows us to appropriately reach folks and make a big difference for them when they're having a stroke.
OSF St. Anthony Medical Center's Dr. Eamon Gaith says it's important to follow the moniker Be Fast, which stands for balance issues, eyes, face drooping, arm weakness, speech difficulty, and T for time to call 911.
One particular story of I think she was in 3rd grade or 4th grade, who learned that acronym, the Be Fast acronym, and recognized a stroke in her grandmother who was babysitting her.
Doctors describe strokes as brain attacks. There are 2 different kinds: hemorrhagic, which is bleeding, and ischemic, which is clotting. It's critical to get to the hospital if you suspect a stroke.
Every minute that goes on, that brain is getting permanently damaged, and the brain doesn't heal like the rest of the body.
Stroke is also the leading cause of long-term disability in the United States, according to Mercy Health's Dr. Vibhav Bansal. He also says risk factors like high blood pressure and smoking are controllable and should be paid attention to.
Diet and exercise are always critically important. Being healthy, will first and foremost lower your risk of having a stroke.
In Rockford, Bria Walters, WIFR News.
Dr. Gaith says strokes impact families as well. There are community support groups for stroke survivors at the Van Meter Encompass Health Rehabilitation Institute. For more information, visit our website, WIFR.com.